Hello, everybody. I'm Dr. Varun from Prabhu Diabetes Multi-Specialty Center and Kaveri Hospital, Trichy. So today I'm going to talk about diabetic neuropathy. So this is one condition where many of the diabetic patients do suffer from. So this is very important to notice because if you started developing diabetic neuropathy, which means your sugars are not under proper control. So this is what is very important that we have to look into. If you get these kind of symptoms in the next few minutes, which I'm going to talk about, and if you have those kind of symptoms, that is where you have a diabetic neuropathy and you should approach a doctor for the good sugar control and get it treated. Otherwise, you might end up in bigger problems because of diabetic neuropathy. So to start with, what is diabetic neuropathy? So it is the default defect of the nerves because of the high sugar levels. So because of the high sugar levels, the nerves don't get proper nutrition, and that is where they have this diabetic neuropathic problem. So usually the patients do come with these kind of symptoms, especially in the foot. So commonly the foot gets affected where the patients will have some weird sensation in their foot. For example, they will not be able to sense the shoes or chappal that they are wearing. They might not be able to feel the sense if they are walking barefoot. They'll not be able to have the good sensation of the floor when they are walking the barefoot. And they might not, they might have lots of sensation like pricking type of pain or some shock-like sensations. So these kind of problems do occur in a diabetic neuropathy, especially in the foot. And that is where you have to look into that. If these symptoms persist, then which means you have a lot of chances for getting an ulcer in your foot. So once an ulcer sets in the foot, then that is called the diabetic foot. And that is where you see many patients suffering because of this diabetic foot ulcer. They might go in for amputation. They might go in for long-term antibiotic therapy or many plastic surgery, things which will happen in the foot. So this is the major complication of a diabetic foot. And not only this, diabetic neuropathy, vastly, it affects the muscles also, where you get chronic pain, very vague pain in your calf muscles or any muscle of your body, skeletal muscles, which get dystrophied, or the energy or the power of those muscles get low because of uncontrolled diabetes mellitus. And also, a single nerve can also be affected. For example, if you have an oculomotor nerve or some nerve in the eye which gets affected, that part alone will not work. So this is called mononeuritis, and this is also happening in diabetes mellitus patients. So even the other symptoms are, you might not be able to have a good sexual relationship with your partner. So there might be erectile dysfunction in diabetic neuropathy. And you might feel giddy once you get up from the bed or get up from the sitting position, which is called postural hypotension, which is the BP difference which happens because of this diabetic neuropathy. Sometimes you might also have unusual sweating, some profuse sweating, and this unusual sweating also is because of this diabetic neuropathy, and unusual vague palpitations might also occur. So these are all the symptoms of diabetic neuropathy, but these can be managed if you have a good glycemic control. There are two other main features which are affected due to diabetic neuropathy, which is a deadly disease. So one major thing is the patients who are suffering from diabetic neuropathy, they will not have the alertness of a hypoglycemia, that is low sugar. So if the patients are not aware of those low sugar levels, they might go in for a diabetic coma. And if the sugars are not administered immediately, once the patient goes in for a hypoglycemia, that is where patient goes in for a permanent brain damage. So we should be aware of this diabetic neuropathy in order to have a hypoglycemic aware. If you are not aware of your hypoglycemia, then you are going to land up in a great trouble. The next dreadful disease is silent myocardial infarction. Because of this neuropathy, the patient might not experience any pain when the patient sustains a myocardial infarction, that is a heart attack. They will not have any symptoms of heart attack. They might not have any pain in the chest, and that is where the patient might go in for a sudden cardiac death. So if the symptoms are present, they can present to the hospital, and the medications can be given immediately to save them from the heart attack. But once the diabetic neuropathy sets in at a greater level, this silent myocardial infarction occurs. Patients do not experience the pain, and they may land up in great trouble losing their lives. So these are the gist of diabetic neuropathy. And if any of these symptoms are present with you, which means you don't have a good glycemic control, please approach to the nearby doctor and get your sugars under control and some more medications to prevent all these kind of complications. Thank you.